Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Check it out. I'm here today with Travis. What's up, Trav?
Life's good.
And we are going to talk today about bioidentical hormone supplementation, growth hormone therapy, and weight loss. So if you have any interest in these, please listen in. We're going to share some really cool information. We're going to cut the break and we'll be right back. Okay. Here we go. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here today with Travis. Hey, what's up, Trav?
Trying to change your lives, man.
And what we're going to do today is we're going to talk a little bit. I'm going to start off and talk about growth hormone. There's a lot of misconceptions about growth hormone. Everybody knows growth hormone is good for them, right? And everyone wants growth hormone, but there's a right way and a wrong way to do it. So just to be clear, let's talk about growth hormone a little bit. So growth hormone is produced in our pituitary. And the purpose of growth hormone in the body, and where it's a big benefit, is for connective tissue. So what is that? Skin, hair, blood vessels.
Joints, nails.
Yeah, all this stuff. And there's actually a direct correlation when growth hormone goes down with age with heart disease, because your heart is a connective tissue also. So there's a lot of new research out there that shows that heart disease is the number one killer of people. A heart attack. And now they're finding that, they're starting to realize that if they could do something to help growth hormone levels, there'd be less heart attacks, which is pretty cool. But, and we have a lot of people that come to Buckeye. They know we do hormone replacement therapy, and they're interested in doing growth hormone. I mean, you probably hear it, because Trav, you're in the front lines over there.
100%.
And I want to clear up, the deal with growth hormone. So growth hormone is necessary, and you want to have it. But there's a right way and a wrong way to do it. And let's talk about the wrong way to do it. And the wrong way to do it would be to take synthetic growth hormone. Okay? Multiple reasons it's wrong. Number one, growth hormone, if you take it synthetically, it works on a negative feedback system. So what that means for you is that if a doctor would prescribe you growth hormone, your own pituitary would quit producing growth hormone. And the problem with that would be if your own pituitary quits producing it because you're taking it synthetically or from an outside source, and you ever aren't able to get that synthetic growth hormone, you would be set into a crisis. You would be stuck with a body that would potentially not produce any growth hormone.
Which is dangerous then, right?
Yeah, heart disease, skin connected, you would be a mess. So that's problem number one. Problem number two. Really, to take a therapeutic dose of growth hormone, you're talking about 2 IUs or 2 international units a day. The cost of that for real growth hormone, the cost is $2,000 to $3,000 a month.
Gosh.
So for most people, that's not a realistic. That's more than most people's house payments, right?
Unless you're in Hollywood, right?
Yeah. So it's not realistic for most people to afford $2,000 to $3,000 a month for a therapeutic dose of real growth hormone. Now, unfortunately, we have people that come in the office every month and they're saying they're buying black market growth hormone for $300 and $400. There's no way this stuff's real. I mean, if real growth hormone is $2,000 to $3,000, that's what we would pay for it from a pharmacy.
100%.
You can't buy $200 or $300 growth hormone. There's just no way. So, but anyways, and then the final problem with taking a synthetic growth hormone is there's no way to regulate or know how much to dose. So what would happen is what you saw in a lot of old-time bodybuilders. Their organs would grow and they get distended bellies. Their foreheads would grow, and their elbows would grow because it does cause, if you take it in too high a dose, can cause these issues. Okay, so which is really unsafe. So that being said, we won't even prescribe it at Buckeye because there's no clinical rationale. It's potentially dangerous, and because of the negative feedback, everything we do at Buckeye, we set up as far as hormone replacement therapy. If someone decides at some point they want to stop, we're not going to damage their internal system. Okay, we supplement stuff. We don't replace stuff. And there's a huge difference between supplementation and replacing. If you replace something, that means that as you're taking away and replace it with something else. We don't do that. No. We supplement. And basically what that means is that if you're deficient in something, we add the exact same thing back in at the proper dosage.
Yep.
Not replacing.
Well, because we know that's going to bring sustainable health. If you take completely out what's been in the body and put something brand new, your body's going to react to it differently. That's what we call side effects.
And that would be growth hormone if you're taking synthetic growth hormone.
100%. So we want to work with your body at Buckeye. We do not interrupt it with pharmaceutical synthetics, chemicals, because that's not going to bring, again, sustainable health. We want to bring long-term health. It's life change, not life interruption, right?
Correct. And that's different. That's something that we do unique at Buckeye. The other thing I want to talk about, so what's the proper way? So, but we do know some people need growth hormone. In particular, people, once they get above 30 to 40 years of age, your growth hormone starts to decline. And how do you know this? Well, your skin, your hair aren't the same. Connective tissue becomes weaker, heart stretches out. These are different signs and symptoms of growth hormone. So what's the proper way to do it? Well, we have a couple obstacles we have to overtake. And first of all, what happens, here's a cool fact. So we know your pituitary is what secretes growth hormone. And the cool thing about your pituitary, Travis, is your pituitary never loses the ability to produce growth hormone. It can always produce exactly how much you need. Unlike a male's testicles, over time, it just can't produce testosterone. So no matter how much we try to boost the production with HCG, there comes a point they just don't produce. But the pituitary doesn't work that way. So your pituitary, up until about 100 years old, can produce all the growth hormone that you produced when you were even a teenager.
Really?
It's really cool, right? But what happens as we get older is our body quits releasing, or decreases releasing, I should say, this thing called growth hormone releasing hormone, GHRH. So as we get older, we produce less GHRH, growth hormone releasing hormone. And what happens is our pituitary then secretes less growth hormone. So problem number one is we got to increase growth hormone releasing hormone. And the way we do that is with a product called sermorelin. Okay, and what sermorelin is, it's been safely used for 20 plus years. And it was actually developed for dwarf children. So originally what happened when a child was a dwarf because lack of growth hormone production, the way they treat it, would they give the person growth hormone. But the problem with that is if you treat a child with growth hormone, they have to take it the rest of their lives. Mm-hmm. So you're talking about $2,000 a month for the rest of their lives, possible overdosing. It really wasn't good. And they came up with this other compound, this sermorelin, that mimics GHRH, growth hormone releasing hormone. So when a person takes sermorelin, or a child takes it, was developed for children, it gets their pituitary to release growth hormone, thus stopping their dwarfism and not having the negative feedback of taking the synthetic growth hormone. Okay, so we give this to adults, or when people's growth hormone levels start to decrease, which we check with blood work, and then your pituitary will start releasing more growth hormone like they did when you were younger at a youthful level. Sounds good, right?
Absolutely.
We do have another problem, though.
What's that?
We have another thing that happens when we get older. So when we get older, all this bad stuff happens.
Yeah.
So our body also starts to secrete this hormone called somatostatin. And what somatostatin does is somatostatin blocks growth hormone receptors. So if someone just takes sermorelin and they produce more growth hormone, that's great. But because our somatostatins increase with age also, we can't use that extra growth hormone. So we still have low growth hormone levels, even though our pituitary is secreting as much growth hormone we have when younger. So we got to block somatostatin. And the way we do that is we use a compound called GHRP2. And GHRP2 blocks somatostatin, thus allowing your youthful growth hormone levels to actually work at a cellular level. And it's a combination product of the sermorelin with the GHRP2 that allows you to have growth hormone levels that you had when you were a teenager. And of course, the benefits of that. What are the benefits? You heal quicker, sleep better, connective tissue stays strong. I mean, we have people on here every I see in the office all the time that are in their 40s and 50s that are in their lifetime best shape. How's that possible? Well, if you give them hormones like when they were younger, and now that they're older and they're more mature and they actually work out properly and eat properly, there's no reason you can't be late into your 50s and be in your lifetime best shape by doing bioidentical hormone supplementation and using the growth hormone boosters. So age is not an excuse.
Yep.
Right? And obviously, it's not all about looking good and feeling good, although we know, obviously, if you do hormones, you're going to look better, feel better. Looking better and feeling better is a symptom of being healthier.
100%. Muscle growth.
And that's what it's all about. That's what it's all about. I was doing a stem cell seminar last night, and some lady came up to me at the end of the seminar, and she's like, hey, I bought some serum that had stem cells for my wrinkles. And there's no such thing. There's no serum you can put on your skin that would have live stem cells. I mean, it's not possible. But anyways, but she was a sweetheart. She's like, I would do anything. If you guys had anything to help my wrinkles or my skin, you treat your skin and your body from the inside out. The reason you get wrinkles as you get older is your estrogen levels, testosterone levels, and your growth hormone levels. So, people spend, how much money on plastic surgeries and Botox and all this stuff. If you don't have hormones, you don't have growth hormone, I don't care what you do to your skin, it's not going to age out properly. So, the simplest and least expensive way to treat your skin is treated with hormones. And we're talking about the growth hormone boosters, the sermorelin, GHRP2, testosterone, estrogen. This is where you start. Because what you got to keep in mind, if your skin, which is a connective tissue, is healthy, your other connective tissues are healthy. What are those? Blood vessels, heart, tendons and ligaments. These are all the things you want. So your skin's really the least important thing, although it's a symptom of what's going on.
Absolutely. And also, and Buzz, maybe you can shed some light on this. And I don't want to sound like an infomercial, but if you're listening out there, sermorelin, along with our hormone replacement therapy program, and one side note I'll tell you is this is why we're a complete hormone replacement therapy program. Not everybody on our program needs sermorelin, right? So this is
you might not need anything. I would say, I say it all the time, I repeat myself. Get your blood work done. The blood work never lies. We just did a TV show right before this episode here, and the lady was on there. She said, "How would I know if I need my hormone, my blood work done?" She was having some hot flashes. Get your blood work done. Just get it done. I mean, your age doesn't matter.
100%.
But if you're having the symptoms of, female with hot flashes, you've been diagnosed with osteoporosis, your skin and hair aren't as good as they used to be, you're eating the same but putting on body fat, you don't have motivation to go to the when I say the gym, exercise, you walk, run, play with your kids, you have more aches and pains. These are all symptoms of hormone degradation with age.
Absolutely.
And they're all reversible. And most people quit exercising because, number one, it hurts too much. Hormones.
Yep.
Or they don't have motivation. Hormones.
Yep.
So it's this vicious cycle. So then you don't exercise because you're in pain, which adversely affects your cardiovascular health, your mental health, everything.
Yep.
And what do you always say, motion leads to emotion, or what do you?
Yeah, emotion follows motion. And as time goes on, you feel worse because you don't have the hormones to make you who you are, so you don't feel like going out as much with your friends. You don't feel like getting up and getting out and getting your blood pumping in the morning, so you start doing less and you start to get a little more sluggish, and 10 years later, next thing you know, you're feeling like, I'm depressed. How in the heck did I get here? And it's all a synergistic cycle. So completing that, we're not here to push bioidenticals on you. People lie, but blood work doesn't. So come on in, get it done. And when we test it by your IGF-1, it's your insulin growth factor 1. It's
That's what growth hormone converts into. So that's what's usable.
Yeah, so that's how we can track it through blood work. So if you don't need it, we're not going to talk to you. We're of course going to talk to you about it to serve you and educate you. But if your blood work doesn't indicate you need it, we're not going to talk to you about it any further. Now, when you do, of course, we will, again, because we're here to serve. But, I mean, you were talking about everything that's associated with low growth hormone, even one that's not brought up enough, depression and anxiety. Is heavily associated with low growth hormone.
So often misdiagnosed in society today. I mean, I think that the not playing conspiracy theory here, but drug companies make a lot of money on antidepressant medications, and as we mentioned before, antidepressant medications, their original intent and design was to help people through traumatic situations. Your dog dies, girlfriend breaks up with you, whatever it is. Take short term, but that's not how they're applied. How they're applied now, you go to your doctor. I don't have energy. I'm kind of feeling lethargic, and I hear this all the time, and it literally drives me crazy. And I asked my doctor. I heard your radio show, and I asked him if it could be my hormones, and they said, "No, you're too young. You're 30. You're in your 30s or 40s. There's no way it's your hormones. It's depression. So we'll put you on this depression medication." And what you have to understand too is a traditional medical office is not set up or trained on how to do bioidentical hormone replacement therapy. They don't have any. It'd be like going to your primary care and doing a bypass surgery. It's very complicated. So you wouldn't go to your regular doctor for a bypass surgery. So why would you go to them for hormones if they've had no training on it whatsoever? They're not trained on anti-aging in medical school. They're trained in medical school on a lot of other stuff. I'm not here to knock primary care physicians, by the way, because what they're tasked with, they have to take people that come in and figure out what's wrong with them and treat, and basically what they call triage and figure out what it is. So which is a lot of work. But that's why there's specialists in every field. If you have a kidney problem, you go to a nephrologist. You don't go to a heart doctor. If you have a heart problem, you go to a heart doctor. If you have an eye problem, you go to an ophthalmologist, right? If you have a hormone problem, go to someone who's trained in hormones. Absolutely. Don't go to your primary care, And people, will go to the doctor and, they'll get their blood work done. I had a person the other day that went to an endocrinologist, and he's treating with us. And the endocrinologist, number one, was doing his serum testosterone levels. This guy is 48 years old, so serum testosterone level isn't even accurate. So it's the wrong test. But he told him that he doesn't want him doing hormones, and he wants his serum testosterone at 500, which makes no sense.
Zero.
So you might say, well, the guy's an endocrinologist, an expert. An endocrinologist is not an expert in anti-aging. It's a total different thing. A urologist is not an expert in anti-aging. There's no anti-aging curriculum in urology school. Now, if you have a prostate issue, yes, perfect thing, but they don't do anti-aging. So just because your primary care urologist, endocrinologist says you don't need hormones, do your own research and get your own blood work done. And go to somebody who knows what they're doing, like we do at Buckeye. Myself and Dr. Bannon are both fellowship trained in anti-aging, which is it's a long process, but I'm confident that we do it better than anyone in the country.
Absolutely.
And we have people that come from all over the country. They literally fly in here every week. Have people come in from far away just to get treated.
And I tell you what's interesting enough, a guy from Toledo was blowing you up yesterday. He's one of our patients saying, basically he's putting his sermorelin order in. He couldn't wait to get it back. And not to sound like an infomercial, but it is one of my favorite supplements I've ever used. And
that's the growth hormone booster.
The sermorelin, the growth hormone booster, yes. And maybe we can talk a little more about that after break. But I know with weight loss or just staying trim and maintaining, it's meant a lot for me. I know I do the intermittent fasting, which is you designate certain hours throughout the day that you don't eat. You can look it into yourself. I don't want that to monopolize it, but there's intermittent fasting, and you take time out through the morning to kind of cleanse your body, get the sugar out.
We'll go over real quick. It's simple. So what intermittent fasting is, and it's very good for anybody. I do it myself. Not every day. I don't recommend it, but a couple days a week. This is pretty simple. There's 16 hours a day at least that you don't eat. You're allowed to have water and black coffee. And you can put stevia with your black coffee, but that's it. Not allowed to have amino acids, not allowed to have anything else. Water, black coffee with stevia, 16 hours a day. And what that does, it allows your digestive tract to recover. And it also gets you into this thing called lipolysis, burning body fat. So if you don't eat food for 16 hours, you're going to have to burn body fat to stay alive.
Yes.
And if you're eating food all the time, which most people are grazing all day long, you never burn body fat because you're just burning off the carbohydrates you just ate. So that's why intermittent fasting is and there's lots of research out there that shows how healthy this is.
Yeah,
lots of research out there.
I feel amazing too. It's literally teaching your body, as you said, to burn your fat when it needs energy. So you don't get hungry as often. Have you experienced that as well?
Yeah, people. There was a guy I was talking to last weekend. Man, that'll be really hard. I'm not gonna be able to do it. The days I fast, I actually have more energy than the days I eat.
Absolutely, and you feel better. You feel like empty in a good way. It's hard to explain. You don't feel any bloat, anything. But what's interesting is sermorelin can help put you into lipolysis as well and can help trigger lipolysis. And if you're out there and you're one of those people like me that has to go the extra mile to lose weight, or you feel like you're that person where your friend's eating a piece of pizza and he's ripped up, but you're eating a salad and you still got weight to lose. I will tell you something that, along with the hormone replacement therapy, well, it is HRT, but along with testosterone supplementation, I feel amazing with this. And whenever you've been into weight loss, when you're in a zone. You can tell when your body's in a zone and you're doing cardio and it's moving. And I'll do a regimen every morning when I wake up, get my blood pumping, get my mind right, where I'll do a half hour of cardio with just water in my stomach.
That's what I do.
Take my sermorelin, and I start sweating, I go, and I can feel my body just being in a primed state. I get energy. It's awesome.
Yeah, and the other thing that helps with too, and I highly recommend for people that have to lose lots of weight, is it also helps tighten the skin up. You know what I'm saying? And one of the telltale signs of low growth hormone levels is abdominal fat. Mm-hmm. So if you look in the mirror and your belly is bigger than it used to be, and you'll have people that have they're lean in their legs and lean in their arms, but they have belly fat. That's growth hormone every single time.
Yeah.
You do the blood, but we've done so many blood works, thousands and thousands at this point. I can see a person walk in, see their body type, and know they have low T, they have high estrogen, they have low growth hormone just from looking at their bodies.
Yeah, because all the blood works and people you've seen matching them together.
Yeah. So I mean, but if you're sitting listening and you're having a difficulty in particular losing abdominal fat, growth hormone.
Yeah, and keep in mind, guys, I'll be 31 this year. You know, so if you're out there thinking, well, I wouldn't need growth hormone yet, it's not you, it's your blood. Get your blood work ran. You know,
you know, in your past, I mean, I think it's important for people to realize is you're morbidly obese.
Yes.
And
yes.
anyone who's been morbidly obese, there's certain people that have hormone issues for sure. Morbidly obese people. If you've taken opioids, if you had high levels of stress,
Yep.
you know, military, police, third shift jobs, people that work. I mean, we have most guys that come in that work third shift jobs and come home and sleep 4 hours and go a day, their endocrine systems are a wreck.
Done.
Because the body, you need sleep and you need sleep cycles. So these are all doesn't mean if you are any of these you have to have it, but if I could bet $20 on every patient that came in that had one of those lifestyle things, I would be a rich man at this point, because you know, they're pretty much all going to have endocrine issues, which affects their health long term.
Yeah, without question.
Yeah.
The other one, athletes. I was a football player, and simply going on a roller coaster, and we can talk this more after break if we need to, but simply going on a roller coaster can cause, you know, tears, can cause some, you know, problems with your pituitary, and when the pituitary messes up, you know, its functions mess up, and that's what produces these hormones, or along with the hypothalamus. So if you're an athlete, played football especially, and you had a lot of head collisions, I know how I had it.
Concussions are big time.
I just played up to high school, actually a couple years after, nothing serious at all. And I tell you, and you can probably remember too, Buzz, how many times your bell got rung, where you just had you'd go home and sleep like a baby. I mean, dozens and dozens of times, and I guarantee that's caused, you know, the issues that I have that we've now fixed. So.
Yeah, and we've been working with some concussion experts in Columbus, which has been a good thing. If you want to talk about that at all.
Absolutely. Dr. Cooper in Westerville, you know, if you want to look
concussions are a big deal, by the way. I mean, and I think we're finally becoming aware of it. I don't know if it was because of the movie Concussion, but like more and more people have always had concussions, but I think we're now realizing how broad a spectrum of kids are having concussions that affect them the rest of their life.
Well, I tell you what's wild, and he'll be on the show eventually, and I can't say his last name, but a guy I grew up with, one of my really good buddies named Jake. He's a Super Bowl champion. He's an NFL veteran. Again, I can't say his last name at this point, but he was telling me he was outside working on his lawnmower after he retired, and he lives here in Upper Arlington, and he was pulling the belt out of the lawnmower, and he just flipped. He said, "Travis, I went crazy, berserk, and I started noticing little things were making me go crazy." So he met Dr. Cooper in Westerville, and he started treating his pituitary with a high-power laser, which that's his treatment I'm not sure on, so I don't want to touch that at all. But then Jake came and saw us, and his hormones were shot. We ran his blood work, testosterone shot. And this is a big, healthy, strong man, okay? And his hormones are almost non-existent. We get his we get his growth hormone where it needs to be with sermorelin. We got his testosterone where it needs to be. He called me the other day. He said, "Travis," he said, "Dr. Cooper got me to 80%. I didn't know if I could get better." He said, "You got me to 100. You guys, Buckeye, got me to 100%.
Awesome.
And that's not us, man. That fulfills us. It's you guys that make this happen. It's not here to brag who we are. It's to find you guys, because this information's hard to find. It's not out there often. So he tells me now. He says, "I have energy." He's staying the same weight but getting smaller clothes. He says his marriage is good, is great. All these things are improving for him, and it's because we don't have to put blind shots in the dark. We can track our treatment. So
with the blood work, I mean, we manage you by your blood work. I mean,
we could find out who Jake was, where he's failing, and where he needs to be. And we got him there with bioidenticals. No synthetics that are interrupting his system. That's not sustainable. No, we supplement. We work along with the amazing machine you've been blessed with. We're not here to interrupt it.
So to conclude here, so basically, if you're listening to the show, strongly recommend come in, get your blood work done. We work with LabCorp, so most insurance covers LabCorp blood work. And we don't charge anything for the consultation. So if you're listening to the show and something you're interested in, go to our website, which is buckeyepmr.com. Check it out. Come to one of our locations, get a blood work done, sit down with one of the coaches. They'll kind of explain the program to you. There's no charge for this whatsoever. And you know, the blood work doesn't lie. If you need hormones, you know, we'll tell you, you know, what you would need and what kind of results you can expect. And the other thing I'll tell you with hormone replacement therapy is this is a night and day therapy. It's not like if you came in and I said take vitamin D or take some vitamin C, which we know is good for you. You don't really feel that though, right? If you're hormone deficient and you do bioidenticals to replace what you no longer produce, it's a life changer.
Yep.
And you feel it. So, well, Trav, I really appreciate you coming on here today.
It's a blast.
Definitely check us out. Check out the website, which is buckeyepmr.com. That's the website. And until next time.